a person can quote unquote have a problem but not be addicted. That's the dichotomy that is still stuck in people's heads, that if we haven't crossed over that line, there's not a problem. What we used to consider characteristics of addiction only lived over there on the severe side. And see, notice that I say side instead of end. Even though they called it a spectrum that ranged from abuse to dependence, that wasn't really a spectrum. It was a dichotomy, one side or the other. And we used to, like I say, consider those characteristics of addiction were only over there on the severe side. And when they suggested that those characteristics can be experienced by people with mild disorders, as I said in the presentation, it took me a long time to get my head around that. And a number of other colleagues were like, wait a second, no, that doesn't make sense. If they're experiencing those things, that is addiction. That was our old way of seeing that. And when I started being able to point out and recognize for myself that, sure, I've got lots of clients that have quote unquote mild disorders, but they can perfectly well give examples of those characteristics of addiction. That's so important because, of course, as I said earlier, the parents, are hoping they haven't crossed over that line into the quote unquote addiction part, the bad part. We're hoping that we haven't gotten there. Well, I can't remember how much I emphasized this during the presentation. The only thing that's going to cause a person to progress into that more severe end of the spectrum is continuing to use. And so if we say, don't use anymore, and they say, okay, I won't use, whether they mean that or not, but we don't follow up with a quote unquote treatment plan, some plan for managing this, those characteristics of addiction rear their ugly heads. Chronic, it doesn't go away. They still have this tendency to use in a problematic way. Progressive, they continue to use more, and also the consequences related to the use can progress. That one example that I gave at the end there of the girl who was placed in the dual diagnosis PHP program, day hospital program. That meant she wasn't going to school. She went to school at that place during the day, but the day that she got back to school after completing 8 weeks of dual diagnosis treatment, she got arrested. That would be an example of her consequences progressing. Her substance use problem didn't go away just because she acknowledged that she should not use. I'm sure she said that many times during that PHP program. But they didn't manage it. They didn't put a treatment plan in place. And we see what happened, and her disorder progressed. When I put this presentation together last week, I realized that this goes into a much deeper or broader topic, and I think really important as we discuss how misconceptions, misinformation, lack of public awareness about our understanding of, watch now, I'm saying terms like addiction. I'm not even saying misunderstanding of addiction, terms like addiction, how these all add up to create barriers and to effective prevention and intervention efforts. And in that case study that I've been using about the 18-year-old, who, was resistant initially, but he gave such a powerful example at the end. The fact that he was open-minded to what I presented to him, and he was able to say, I really liked how you changed that understanding for me, when that point about you have a problem but you're not addicted. And that softens it up so much, as far as it's not threatening to them, for to say, and I suggest, you see that we should manage this. um, uh, I don't know if I said this in the presentation, but he said that he had been, um, avoiding the second floor bathroom at his school, and he had stopped going out on weekends with his friends that party. And I told him, you're treating your substance use disorder. You have a mild substance use disorder, which his therapist, and this is the thing that really chaps me, is that therapist for a year told him, and told the parents, he's got a mild substance use disorder, which means it's only mild. We don't need to do anything about it. And 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 as far as developing a treatment plan. And so when I said, you've been attempting to treat it yourself, that's what treating it is. Making a list of things I should, change in my lifestyle. Don't go by the second floor bathroom. Don't go out with my friends who party on weekends. And then all it takes is suggesting, can you see that maybe having a little bit more sophisticated approach to treating this, like having a professional help sort of supervise doing that. And he was fine with that. So that's one of the first points that I think is so important out of this presentation, is recognizing that a person can, quote unquote, have a problem but not be addicted.